Assalamu alaikum everyone. Hope you all are doing fine. Welcome back to the channel. So we were doing our major connectors, and which I just in the previous lecture I just explained some basic knowledge about major connectors and types of major connectors. Okay. So now we will be starting our mandibular major connectors. Okay, in this second lecture of the major connector. So moving on. Mandibular major connectors. Okay, so we have six type of mandibular major connectors that we can give, but most frequently and most advised kind of a major connector is the lingual bar. Okay, second type is the lingual plate. Then we have some sublingual bar, lingual bar with cingulum bar, and the labial bar. In this picture, there are all six types of these. This is your lingual bar. See, this hole is the major connector. This, okay, and it is your lingually placed lingually, and it is in a bar form. So this is your lingual bar. Then you have a lingual plate. This is your lingual area, and see, it's covering whole length of this lingual area. So this is your, and it is in a plate form, plate shape. Okay, so this is your lingual plate. Then you have a sublingual bar. If you can appreciate here, see, this is your supra lingual area, and this lingual bar, this is your lingual area. Okay, and this lingual bar is below this lingual area, so this is sublingual bar. Then you have a lingual bar with cingulum bar. This is a cingulum bar. Okay, these areas will be placed on the cingulum of the tooth. Okay, this area will connect with the cingulum of the tooth, and this is your lingual bar. So this is a combination of lingual bar and cingulum bar. This one is your cingulum bar. Okay, you can see it's only covering the cingulum of the teeth, not the lower soft tissue area or the lingual area of the jaw. Okay, see, this is your cingulum bar and this is your lingual bar. So this combination is the sublingual bar with cingulum, and this is your solely cingulum bar, and this is your lingual bar. Then you have a labial bar. It is basically the most compromised type because it can be seen as it's not aesthetically pleasing. Okay, see, it is placed labially. This is your labial bar. Okay, but the most recommended and most used in all these six type of connector is which one? Your lingual bar. And if not, then you give a lingual plate, but you rarely move to labial bar because it's aesthetically not pleasing. One can see all these metal in the mouth of a patient, or one's mouth. Okay, so we don't go for that mostly. But in if all of these are some kind of compromise, and patient is compromised, and these all are contraindicated, then obviously you have to give this one. Okay, so moving on. Okay, lingual bar. Now we will be studying all these kinds of mandibular major connectors separately. In this video, we will only covering the first two, and then I'll be uploading another lecture in which we will covering the rest of one. Sorry, we will covering the rest of one. So lingual bar. Lingual bar is a half pear shaped lingual bar. If you cross section this lingual bar, the shape that will you will see in that cross section is a half pear shaped. Okay, it is made up of reinforced 6 gauge half pear shaped wax. Okay, it's a kind of a wax, and it is reinforced 6 gauge. Okay, so your lingual bar is made up of this kind of a wax. The minimum height of lingual bar, this bar, like this height of the metal is of 4 mm. Okay, the superior border should be tapered toward the gingival tissue superiorly, with its greater bulb in the inferior border. This superior border should be tapered towards the gingival tissue. Okay, and the bulk should be in the inferior border. Inferior border should slightly be rounded that it will not impinge the lingual tissue. Okay, and additional bulb is necessary to provide rigidity. To keep this thing in its place and strong, you need to provide sometimes additional bulk of the material. Keep a minimum force space between the gingival margin and the superior border of the bar. This distance is of 4 mm. Okay, this distance from this gingival margin to the superior border of the lingual bar. This distance is also of 4 mm. If the inferior border of the connector should be as inferior as possible, this inferior border, it should be placed as inferior possible so that it doesn't interfere with the resting tongue, and there shouldn't be any trapping of food. Your tongue rests in this area. Okay, this is basically a cross section of the picture. Okay, so your tongue is resting here, and if it's somewhere above it or something, your tongue will constantly get trapped between these lower tissue and the bar area. So to avoid that, we place this bar as inferiorly as possible. Okay, at this bar's inferior border should be placed as inferior as possible. Okay, to avoid the trapping of the tongue and food, and the avoidance of the tongue movement. Okay, so moving on. Okay, so now advantages of lingual bar are that it provide excellent retention and support for prosthesis, maximize the use of natural tooth structure, minimize the tooth preparation. Okay, allows for more aesthetic and comfortable fit for the patient, easy to clean and maintain, and provides good rigidity and resistance to deflection. So these are the advantages of your lingual bar. Similarly, it has some disadvantages as well. That is that it may interfere with the tongue movement. Okay, every kind of a thing can interfere. Every kind of a connector can interfere with your tongue movement if not made correctly. Okay, so it also may interfere with your tongue of the patient, and it may not be suitable for all patient. Okay, every patient have its own anatomy and own thing. So there may be a condition in which you cannot give the lingual bar to the patient. You have to go to other options. Okay, so it may not be suitable for all patients. So this was all about your lingual bar. Okay, now moving on. Okay, so how do you, for all, this slide is for all upcoming mandibular major connectors. Okay, how do you know how much is your how do you measure this depth of the bar or depth of the plate that you are placing in? You take a probe. Okay, you take a probe, place it on the surface, on this incisal surface of the tooth, and then down below to the distance where you want your inferior border or the superior border of the connector, and you measure that area. Okay, this probe has its own marking. You read those marking, you convert those marking to mm's. Okay, and then you take this sorry then you take this measurement and transfer it to the cast, and then you cast down, then you made marking here, make a marking here, and then construct your plate or construct your connector or construct your denture on this marking area. Okay, so this is how you measure the depth from the incisal margin to the floor of the mouth where you want to keep your connector. Okay, so this is how you measure the depth of the length of the depth of the floor. Okay. Okay, so Linguoplate, if anything is not clear, kindly do comment down. Okay, or do ask me. I'll make my best efforts to clear your queries out. Okay, and if you want more on these things, you on these lectures, you can always go to your recommended books. I'm making this lecture from McCRAKENS, so you can always go to there and read the content out, and always point out if I'm wrong anywhere or something. Okay, so moving on. Linguoplate, the second kind of a major mandibular major connector is your lingual plate. See, it's in a plate form, and that is a bar form. That was a bar form. If a rectangular space is bounded by a lingual bar, the rectangular place is bounded by a lingual bar, the anterior tooth contact and cingula, and the broadening of minor connectors are filled in. It results in a lingual plate. Okay, how a lingual plate is made? If the lingual bar, see, if I give here a lingual bar and this whole area is covered with the other kind of a metal covering till cingulum of the tooth. Okay, this the covering till cingulum of the tooth, and then you give your all other components that rest and direct retainers and indirect retainers and the base of the denture, and then tooth. Okay, that constructs your what linguoplate. Okay, if you're getting my point here. Okay, so how a lingual plate is made: you placed a cingulum bar and then cover that cingulum bar, lingual bar, sorry, you place a lingual bar and then cover that lingual bar till the cingula of the tooth with the metal. Okay, that's make your lingual plate. Lingual plate is made as thin as possible and should allow the lingual contours and should follow the lingual contours of the teeth connected. This is another picture of the same denture. Okay, you see these area, this is covered till the cingula of the tooth and it follows the contour of the teeth. Okay, it is same as the contour of the teeth. The upper border should follow the natural curvature of the supralingual surfaces of the teeth and should not be located above the middle third of the lingual surface. These areas, these cingulum areas, okay, should not be more than the middle third of the lingual surface of the natural tooth. Okay, the half or it will be seen by it will be like can be seen when a patient talks. Okay, if the middle third of the lingual surface is crossed, it will be seen in the oral cavity when a patient is talking to someone. Okay, and it will look bad, it will not be look aesthetically good in that sense. Okay, so that's why we don't cross the middle third of the lingual surface when making these kinds of a this kind of a lingual plate. The half pear shape of a lingual bar should still form the inferior border that provides the greatest bulk and rigidity. It should supported by the rest, which shouldn't be positioned further than the first molar. Okay, this is your first molar, and here are your rest seats. Can you see this little thumb like kind of a projection here? Okay, see, these thumb kind of a projection are your rest seat. They go and rest on the occlusal surface of the tooth. Okay, so these rest seats should not be posterior, more positioned more posteriorly to the second premolar or to the third molar. No, it should be always on the first molars. Okay, it should be supported by the rest, which shouldn't be positioned further any than the first molar. Should be positioned as low as possible in the floor of the mouth to avoid the interference with the soft tissue. Same as lingual bar. Its inferior border should be as inferior as you can place it to avoid the interference with the tongue and the soft tissues. Okay. So when to give a lingual plate, we obviously first go for a lingual bar, okay, in all the patient that walks in. But what are the indication when we are not going for a lingual bar and we have to give a lingual plate? Okay, when the lingual pharynx is high and there is no space for a lingual bar, irritation should be avoided only by generous relief. Okay, if the gingival margin is slightly elevated, floor of the mouth is less than 8 then the lingual plate is recommended. Okay, so when there is not the distance of 8 between the uh, margins of the gingival margins of the natural teeth and the floor of the mouth, then you give a lingual plate. If a tori is present, okay, in these if a tori is present, you don't go for a lingual bar, you have to go for a lingual plate. Okay, in class 1 situation in which the residual ridge have undergone excessive vertical resorption, a correctly designed lingual plate will engage the remaining teeth to help the horizontal rotations. Okay, you have to give in class 1 situations a lingual plate. For stabilizing periodontally weak teeth, splinting with a lingual plate can be some of value when used with definite rest on sound adjacent teeth. Straightforward that is, when the future replacement of one or more insider teeth will be facilitated by the addition of retention loops to an existing lingual plate. Okay, you are giving you are replacing some of the future. You see that in future some of the teeth have to be extracted, so you go for a lingual plate because you know you can add a tooth on that denture again. Okay, so on the previous on the existing lingual plate that you have already given. Okay, so when you are going for a future replacement, you go for a lingual plate. Also indicated in macrofacial defect. Okay, these are the 7 indication of a lingual plate, in which in these condition you go for a lingual plate rather than a lingual bar. Hope everything is clear in here. Okay, so that will be all. We will be covering our other 4 kinds of mandibular major connector in the upcoming lecture. In this lecture, we only covered the 2 major kinds, that were lingual bar and a lingual plate. Okay, so if you have any query, if you have any confusion, if you have any kind of a question, always comment down on my video. I'll make my all efforts to clear your query or question or a confusion, whatever is that. Okay, so do like and subscribe my channel and share my videos also, and follow me on Instagram. I go by the name of Dr. Barira Mushtaq. Thank you. Allah Hafiz. Take care. Bye bye.